Good afternoon. Welcome. I am Madeleine Thakur, President and CEO of the Children's Movement of Florida, and thrilled to welcome you to our Legislative Session 2023 recap. The Children's Movement of Florida is the state's leading voice on early childhood, championing the policies and investments that children need in their 0 to 5 years, early learning, healthcare access, and parent support. And while you may not have seen these issues in the press amid so much else going on in the headlines over the last couple of months, there are some bright spots as we look at what was accomplished in the 9 short weeks of Florida's legislative session. So I've invited a dear friend and colleague, Michele Watson, to join me for a conversation this morning to unpack this for you. And I'll introduce her in just a moment. But first, let me just share a couple of housekeeping items. We are using Zoom's live transcript this morning. So if you'd like to see closed captioning throughout the conversation, just click CC Live Transcript at the bottom of your screen. We are recording today, and so all of the material will be available after the fact. We'll ask you to please make use of the chat function. Why don't we have everyone introduce themselves there now? Tell us who you are and where you're watching from. And for those of us in Zoom, please use the Q&A function for your questions. We'll do our best to answer live as we can, but we've got a packed half hour for you. And so our intention today is to have a conversation with you, with our colleagues and friends who wish to make progress for our youngest children in Florida. We love seeing your energy and ideas flowing in the chat, but we ask you please not to use this space to solicit. But let's just get to it. So Michele Watson is CEO of FACT, the Florida Association of Children's Councils and Trust, and based in Tallahassee, Florida. Many of you know about the county level children's councils and trusts all over our state, now covering 60% of Florida children. But you may not know that Florida is one of the only states in the nation that empowers communities to create these local government entities whose sole purpose is investing in the well-being of children. So Michele's video will be coming up momentarily and you will see her face. She's a data guru and education policy expert. Got her career started in the early learning classroom. She's a former educator in Polk County, former policy chief for the Office of Early Learning, and in her current role is focused far beyond the early childhood years on the whole spectrum of cradle to career. FACT is an important partner of ours on Florida's Early Learning Consortium and in our advocacy, and importantly, the creator of the bill tracker that we bring to you during legislative sessions. So thank you for that, Michele. We promised you all a 30-minute conversation on budget decisions, on bills passed or not that impact early childhood issues. And that doesn't give us much time. We'll focus just on 3 big questions: on healthcare, on early learning, and on the budget. So welcome again, Michele. Welcome all of you. Thank you for introducing yourselves all over the chat. We're so happy to be with you.
Thank you.
So first question to get started, there was a big win this year for children's health care in a long-awaited expansion of kid care. Tell us more about that and why is that so important?
Absolutely. So, at the Florida Alliance of Children's Councils and Trusts, we've been really focusing on looking at generational strategies to solve for poverty. And quite a few years ago, in about 2018, we produced a report basically stating that, individuals that access social services that have young children, they are more likely to stop and park along their career lattice because getting potential increases in employment and in their dollars that they bring home, they actually lose social services. And we all know that that's called sometimes fiscal cliffs or benefits cliffs. And so last year, Representative Robin Bartleman wanted to file a bill to expand kid care, and she wanted to move it up to 250% and then 300%. We sat down and we really got to meet with her and we say, okay, listen, do you want to solve for the cliff? Or do you just want to create a cliff that's a little bit farther down the road? And she said, I want to solve for the cliff. So we did a lot of support and modeling, working with her to determine how do we create a nice glide path for families that as their income increases, the they don't lose those social services, but they start paying a little bit more towards the full price of those social services. So this year, we are so glad House Bill 121 passed, huge bipartisan support in both the House and the Senate that passed unanimously, that expands kid care eligibility, so which is the state's funded healthcare insurance, up to 300% of the federal poverty level. Now that will go into effect January 1, 2024, and that gives Florida Healthy Kids Care Corporation the opportunity to do the things they need to do to get ready to determine eligibility for this increased income level, which is reprogram the application, make sure that there's marketing, outreach, and awareness materials out there. So beginning January 1st, 2024, we will be able to serve children and families up to 300% of the federal poverty level. And according to a bill analysis done by the Florida House during the legislative session, that's going to represent approximately 77,000 additional children based on census data. So we will be looking to all of our nonprofits, all of the service providers throughout the state to help inform families of this extended eligibility opportunity to continue to ensure that children have access to health care, dental care, mental health supports that they need so that they can grow up healthy and thrive.
Yeah, wonderful. Yeah, Representative Bartleman been a champion for this issue for a long time. And I was just scrolling through the chat as you were talking. We've got a lot of participants from Miami-Dade County, and a shout out also to Senator Alexis Calatayud here, who carried the bill in the Senate and helped to get this over the finish line.
If I didn't speak about Representative Dana Trabulsi, Senator Keith Perry started this journey last year as well. And so just all around understanding families and the hard decisions they have to make, and really just strong support. Speaker Renner was huge in getting this to move. This was in his opening day remarks that families should not have to choose between a raise and having their children grow up healthy. And he absolutely stuck to his word, and it has been passed and enrolled, and we're waiting for the governor to sign it.
Great. 77,000 more children accessing health coverage is nothing to sneeze at. So thank you for that. So yet again, we were following another big early learning bill this year. Didn't make it past the finish line. But what in that bill should we look forward to next year, and what snuck in this session?
Absolutely. So, I think early learning, we had been so focused on accountability in our state and federally funded programs for so many years. And then one of the themes that we're seeing coming out is that not only are we having workforce issues in the early childhood space, but costs are going up, inflation is happening. So the early learning bill this year, I felt, was a really different approach. It wasn't about necessarily wholly about education and accountability. It was really about what are the levers and pieces and parts that we can pull to really help offset the high cost of care for families in Florida so that they can work, so that they can access what they need. So this bill this year that did not pass really looked at three silos. It looked at childcare licensing and what are ways that we could look at what are some of some excessive, redundant, or duplicative licensing indicators that maybe we could scale back on that don't necessarily lend itself to being the most important for child health and safety. So what are ways we could look at those, minimize those, ways that we could look at professional development and training and create synergy and streamline those requirements, make sure that they are really what the workforce needs to be successful in the classroom, as well as just taking out some arduous requirements for childcare providers that they really have no really authority over, such as making sure that their children aren't left in the back seats of cars and having to call every day, where the liability and that onus and that work is taking away from the good work that's happening in the center. Same with the influenza and flu brochure, those were kind of being taken out. So it was a really overarching work about what are the structural components that you need to ensure health and safety that are not going to create burdensome regulations that are going to actually be passed, that cost is going to be passed on to families. So that was kind of step one of the bill. The second was, how do we really create a tax incentive package, an early learning tax incentive package, so that what we can see is a shift in how childcare is funded. So right now, childcare is funded in the fact that government pays for childcare, parents pay for childcare, and let's be clear, childcare providers pay for childcare because they don't charge what it actually costs to serve a child. So they're subsidizing this sector. And so how do we change that narrative to, we know that employers need workers. We know that they absolutely need stable workforce, not only just new workers, but how do we keep and retain the staff we have now and the employees we have now? So the second was, how do we create a tax incentive where we bring employers to the table in one of two ways? They can either create their own childcare facilities if they have a big enough corporate footprint to where their individual employees would be able to access those childcare facilities. And then the second is, how do we allow a tax incentive where employers who offset the cost of childcare for their employees would basically get a tax break in their taxes. And it was against their income taxes, their beverage taxes, right? We wanted to go ahead and open up the expanse of taxes, their insurance taxes, everything that we could think of that would incentivize them to participate. So $300 a month would approximately be $3,600 a year that they could pay on behalf of a child of their employee to access high quality care. And that absolutely is really part of opportunities to help, one, stabilize the workforce, put more money, and then also make sure that families have what they need to be able to survive their household budget. So that is something that we are hoping will come back next year. We are creating a work group this summer to really meet with HR directors, meet with employer corporations, figure out how do we design this that, one, makes it easy for employers to participate, and two, maximizes participation around the state to offset that. So there's a question saying what bill's being discussed. It is Senate Bill 990, House Bill 1021. They did not pass. And so this is just kind of a debrief of the approach to early learning in the legislative session. With that being said, then the third part was really looking at probably some glitch fixes and some opportunities in the school readiness and VPK space. One of the things we saw this year was a large concerted effort to look at screens and what that impact is on the development of young children, students. Social media was another huge issue that was contemplated this year by the legislative session. And I see that still being looked at next year as far as making sure that there's a delicate balance of access to screens as it relates to instruction beginning in the earliest years. Then we also saw some resetting of the VPK accountability timeline, just based on implementation concerns, things that obviously we in not only in the early childhood workforce, but in the scaling of a system that large moving forward. And so we saw that as well as some other things. So that really was the comprehensive approach of how do we really think about what are families paying? How do we help reduce some of the burden on providers and look at it from that lens more so. So within that, there were a few items that were in that kind of initial bill that I just kind of unpacked for you that actually got into another moving train, we like to call them, pieces of legislation where the topic is germane and you can amend onto it. And that was House Bill 443 by Representative Valdez. That's the education bill. And so one of the three pieces that we got from the early learning bill tagged onto that bill was the responsibility for DCF to create a work group to look at those redundant licensing indicators, to look at the professional development and provide a report to the governor's office, the speaker's office, and the Senate president's office on their findings by December 31st, 2024. So DCF will undergo that analysis and work and provide that feedback to the legislature to determine if they want to enact public policy around that, if they just need to open up rulemaking, et cetera. The other thing that was tacked on to that bill, House Bill 443, is some of you know about House Bill 1, what they're calling the Universal School Choice Bill. As part of that bill, there was a new section of law created which would allow families to access a website that would give them all of the information around all of the opportunities around school choice, whether it be public schools, whether it be charter schools, whether it be private schools that participate in the scholarship program. So it was this statewide educational choice platform that would house all of the information around what is their curriculum, what is their teaching styles, what are their class sizes, et cetera. And so one of the things that got put onto that bill was making sure that there is consideration for an early learning portion to be integrated into that platform, so that a family that has multiple age children and they're looking for the best educational settings for their children could be able to access it and find information on an infant program as well as a third grade program or a toddler program as well as an 8th grade program. So that legislation got into the bill as well, House Bill 443, to make sure that the child care profile that's required under child care resource and referral is integrated into that educational choice platform, so that we can have parents going to one stop to find the best educational settings for their children. And then the last is that through participating in the school readiness program and in the VPK program, looking at, because there are a significant number of level 2 licensing violations, what they did is they just said they had to be the same licensing violations. Instead of individual distinct licensing violations, they basically said you could lose your gold seal certificate if you were identified as having a problem and then you refused to fix it and it showed up again and again. And so that is some of the language that we saw woven throughout, is to make sure that they are the same violations, which means that they have been told and they are not making the movement to correct those issues. And so that really is kind of the substantive language that got moved over. We were able, through Senate Bill 2502, and when I say we, the entire state was able to kind of sunset for 1 year the class impact on the VPK accountability system. So class scores for contracting will not go into effect next year, which was the previous bill. They will then be, you will have to have a class level 4 next year on your class before you lose your contract. So it just gave more time to that timeline. That's called an implementing bill, which means you have 1 year to do it, and then the legislation reverts back to the previous legislation. So that's what happens. That means you get one shot to do it. So this is just a 1 year carve out, since we had some implementation scaling issues with finding staff and new system, to make sure that we had 1 more year to get those class assessments timely and get everybody into the system.
Yeah, I mean, so much of this has been a process over the years. You talk about that parent profile that the big early learning bill last year contemplated, HB 419, or I guess is that a couple years ago now, you know, wanting parents to have the information about the programs that are available. And you talk about the class assessment was this idea of giving a job description to teachers and not evaluating just on one assessment of children, but look at what's happening in the classroom. And so giving more time for that new accountability structure to be built out with the right coaching and all of that. It's important to see that extra year. So it's encouraging to hear that some pieces of that bill made it through. Sounds like we are waiting next year for this early learning tax credit to develop. Something really important. Just if you're joining a bit late, this is the idea that employers can put in up to $300 a month in support of their employees' childcare. And so there's a commitment, I know, from the Senate and the House to work on this over the summer, and they want to see it come back. They just weren't ready for it yet this year. And I would just point out one other piece of that legislation. I saw we've got at least a couple people from the family childcare world tuning in. So that bill also included a fix there on zoning and insurance regulations for family childcare. So that will come back next year as well.
And I think that that was for large family childcare, because that was an oversight. You know, a few things I would love us as an industry to discuss, right? We still refer to family childcare homes as family daycare homes in statute, right? How do we flip some of that language so that people understand that's education? And then what we're hearing a lot across the sector is some of the insurance components of that you are having to retain as part of running a childcare center are offsetting all of the good investments that are being made to try and pay staff more dollars, because insurance has gone up significantly. So would love to talk about, you know, how we can potentially just look at insurance and other opportunities for childcare centers to reduce those costs so that we can get as much money into the hands of the workforce as possible.
Fantastic. And speaking of the workforce, do you want to take a couple minutes to talk about the background screening bill too? I know that impacts this sector.
Absolutely. So last 2 days of session through a Hail Mary miracle, the background screening bill, which is Senate Bill 676 by Representative Grahl, passed, and the companion was run by Representative Trabulsi. And what this does is it finalizes kind of a two-part piece of legislation. Last year, they moved all of the educational entities into the ACA. So ACA is Agency for Healthcare Administration Background Screening Clearinghouse. It is a nationally award-winning clearinghouse that was created to maintain and retain fingerprints for individuals that work with vulnerable populations, such as children, the elderly, those with disabilities. And so we moved education into that beginning January 1st, 2024, or a date determined by ACA because they're undergoing modernization of the system. And then this year finalized moving VEX. So that is the Volunteer and Employment Criminal History Check System. Those are for all entities that fall under the National Child Protection Act. So those that need to be background screened. And so what that allows for is when you move everybody in, we also made sure that coaches have to be level 2 background screened, which was not necessarily the case. They had to be level 1, but level 2, we're going to make sure that they are adequately vetted if they work with children. And so what that does is allows for portability. So that means if you are a teacher during the school year and you go and work in an early learning setting over the summer or a summer camp during the summer, all you need to do is tie your record from your education roster to the new entity's roster. So you will have portability. And even if, let's say, the education requirements are not the same as the childcare licensing, the only thing you'll have to do is request an agency review for DCF to get those final pieces of the childcare background screening done. So what we're hoping to accomplish is to maximize portability of background screenings, not having people paying for multiple background screenings over many years in time just because they want to involve themselves in civic engagement through volunteerism and or participate in different work opportunities. As long as your record is in the ACA clearinghouse and retained and tied to a roster, you should not have to undergo multiple background screenings. And so we're hoping throughout these efficiencies that over time, it will actually reduce the costs. And within that bill is also the requirement that FDLE create a biometric that you would be able to determine who you are so that eventually you will not have to put your fingers on the glass through the live scan again. That biometric would authorize you and authenticate you, and then your records would be retained and maintained. So hopefully over the next many years, we're going to see background screening come under one cohesive umbrella that makes it easier for you to gain employment, participate in civic engagement, and basically intersect with multiple opportunities to work with young children, etc.
Yeah. Fantastic. Some of that's a little wonky, but I'm reading the chat and see that there are people who appreciate this. And Lane Polikoff says, bravo. So one other bill I'll mention before we move into the budget is, I don't have the number handy, but you'll see it in the chat, is on lactation spaces. And I just want to raise that one. I know it's come up for several years, and this was Representative Ashley Gant from Miami, Senator Lori Berman from near Palm Beach. And this is about courthouses, making sure that employees in the courthouses and also the members of the public who visit have access to a space that is not a bathroom. And these are important for all kinds of reasons. And when we think of employers, we're often thinking of private companies, but the courts are employers as well. And so many members of the public visit. And so this is huge. Michelle, in the, let's see, 6 minutes we have left, let's talk about what's in the budget for early learning. There were some wins there too. And while you're talking, I'll go through the Q&A and see if we can get to anything more before we close.
So we saw banner year spending across the state, $117 billion budget, the largest in Florida's history. And within that budget, there's something for everybody. But we are very excited that we saw some of the largest early learning spending in history. So $890 million in school readiness dollars will be sent to early learning coalitions, including not including an additional $77.5 million to be utilized by early learning coalitions to ensure that they do not disenroll children that they may have enrolled over the last year. So making sure that there is plenty of money to make sure that we are not disenrolling children moving forward. There's $30 million in a literacy micro-credential, so helping our instructors that work in school readiness and VPK and hopefully after school programs, they can access the micro literacy credential that is being offered through the University of Florida Lastinger Center. Upon completion of that 60-hour micro literacy credential, they get a $2,000 stipend, which is huge for our workforce. So that is open and waiting for cohorts to join. There was also $10 million in Teach, and we have previously gotten $10 million in Teach throughout the state, but this year it was made recurring dollars, which means we will continue to get $10 million in Teach and I don't want to say in perpetuity because nothing's ever in perpetuity, but for many, many years to come, so that we can continue to support our instructors and workforce in getting their CDAs, getting their AAs, their bachelor's degrees, whatever their educational opportunities are. So really excited that that funding has been finalized moving forward and will be reoccurring dollars. We also saw a record high in VPK funding of $2,941 for the school year program and $2,511 for the VPK summer program. Within that, unfortunately, what we did not see come back was the $15 an hour language that basically states that if you attest that you're paying $15 an hour for your VPK teachers, you get the supplemental dollars for towards the VPK BSA. And so while it is record high spending for VPK, as far as the per pupil BSA, it's going to feel like a loss because we lost the $100 million that was set aside for the $15 an hour initiative. So with that being said, the other huge thing that was in the back of the bill, so there's a section in early learning that you read through, and then you have to go to page 480 in the back of the bill, was that there is about to be $315 million made available for early learning coalitions and childcare providers to be able to apply for dollars. And they would apply to DOE/DEL for that money. And that can be anything such as childcare capacity, professional development, workforce training, curriculum supports, a long list of items. So that is kind of the last of the ARPA discretionary dollars that will be spent over this next year. So that is very important to providers, can continue to help stabilize and move forward and hopefully onboard staff, get everybody in some sort of continuum of professional development should they need it, capacity building should they need it, et cetera. So that is really big money that's about to be out there. I'm sure the Department of Education Division of Early Learning is working as hard as they can to get that application out. That is a big, heavy lift. So stay tuned for more of that information, but that's going to be a lot of money that's going to be put in the early learning space this year as well.
Say again, Michelle, that 350 million is going to support new enrollments, is going to support, tell us again.
So it's 315 million. And within the 315 million, there is a list of appropriate activities that those grants can be used for. Capacity.
And that's local discretion. Okay. So early learning coalitions want to hear from you, perhaps.
Well, early learning coalitions can apply. So an early learning coalition can apply to the state, and childcare providers can apply. So it can be as large scale as a huge early learning coalition initiative that they want to start based on need in their community, or it could be as small as a singular childcare provider needing some curriculum support, for example. So it is pretty broad in as far as who can access it and what it can be used for. So exciting.
That's great.
Start putting
and we've
caps on.
Exactly. So we've had a lot of questions across the board about how do we let people know about these changes? Where do you get access to the background screening? You know, is part of the answer once the governor signs this and we've got this set up, then we will direct you, or is there anything available immediately?
Absolutely. Once the governor signs the budget, right, he still does have the ability to line item veto some things, right? I've never seen him really veto anything back of the bill, but he has, but it's not a lot. I can tell you that DOE DEL is probably looking at all the legislation and creating a roadmap for how they're going to implement this new stuff. But the grant, it doesn't have a title. It's just back of the bill money. It just says they can create a grant application process. So there's no name of the grant right at this moment, but I know DOE and DEL will work with the early learning coalitions to get all that information out as soon as they build the application and determine what that process is going to look like. So it's on, I saw it on page 480, depending on which version you're looking at. And I think it's section 53. If anybody wants to look in the actual General Appropriations Act.
Awesome. And thank you, Victor, for pasting from there some of the things that can be used on.
Yeah.
So like you said, really, really exciting that individual providers can apply or coalitions can apply. And it's really about supporting local needs and understanding that it is different throughout the state. So this is always a whirlwind, Michelle. I can't believe it's already 12:30 and we are out of time, but thank you for doing this. And all of this will be available after the fact. We'll share a summary as well. And so really glad you joined us today. For our audience, we'll be back with another live event just about a month from now. June 15th is our Reading Pals second annual conference and celebration. So we'll address grade level reading, the science of reading. Michelle's colleague, Jen Faber, will be joining us, who I saw in the chat here too. And it's all about the concepts, skills, and insights that could apply if you're a volunteer, if you're a parent, if you're an educator. And so sign up to join us then. And thank you for your interest in all things Tallahassee today. Thank you again, Michelle, for sharing your insights with us.
Of course. Thank you.
Have a great day, everyone.